Welcome to the High Tea with Grace podcast, where we spill the tea on HIT. Today, I'm honored to welcome Kelsey Powell, VP of Strategy and Operations at Vital. Thanks for joining me, Kelsey.
Thanks so much for having me, Grace. Thrilled to be here.
So tell me a little bit about the career path that brought you to your role today.
Sure. Well, I started my career in healthcare consulting. I worked across a variety of provider settings, from large health systems to even some retail settings and even some startups. And the structure of that was so much fun because I got to work with so many different leaders across so many different platforms and really learn quite a bit of the healthcare and healthcare innovation space. But as I progressed through that career, I noticed that I just had a love for helping these companies get to the point where they were operating really efficiently and smoothly. And then I had to leave and jump to something else. So I made the leap over to my current company, Vital.io, or Vital Software, when I decided that it was time to help with those operational efficiencies and the strategy, but really see it through. And so it's been so much fun to work with my current team on innovating in the patient communication space and really making a difference in healthcare from here.
So tell us, why is patient communication in healthcare such a challenge? It shouldn't be.
You would think, wouldn't you? But really, it is, because healthcare is complicated, right? I mean, people go to medical school for 8 years for a reason. It's a tough thing to understand. It's a tough thing to go through. It's often scary and confusing when you're the patient too, and understanding the balance of how to communicate those challenging concepts in a way that is digestible in such a sensitive setting is tough, not to mention the broad technological landscape that can bring us information. So, we can see in our patient portals that we have a variety of health metrics, but maybe we don't know what that means. And then we only have so much time with a provider. So ultimately, there's just challenges in this setting, right, that don't exist necessarily in other spaces in life. And so it's our goal at my company, and kind of one of my personal goals, to try and bring some transparency and some clarity and calm to that.
So many health systems often claim that they have no budget for patient experience solutions, which is absolutely insane, because patient and caregiver retention is critical to their business. And that seems like a cornerstone of that. So is there a pressure to show strong outcomes as a patient experience solution? And what hard metrics should leaders track beyond just time saved to prove impact when it comes to patient experience?
Yeah, that's such a good question. And it's understandable, right? I mean, you're asking about these large healthcare systems that have massive budgets, but also unbelievable expenses, and taking care of people and taking care of their lives. And of course, their first priority is making sure that they're able to pay their physicians and have the equipment and do everything they need to be a successful and impactful health system. However, you make a great point. Patient communication is the bridge between that care and the patient themselves, and the patient having the empowerment and understanding to be able to take care of themselves as well. And so in order to see the impact and really believe in that mission beyond, of course, just the idea that it's right to talk to your patients as much as possible, I think it's really important to think about utilization, actually, would be the metric that I would push you towards. So a lot of our clients, for example, will tell us that they're super excited that they had 10% utilization of their EHR portal in the waiting room of their ER. And that's great. I mean, absolutely fantastic that 1 in 10 patients is looking at their information in real time. However, we think that's not enough. Like 1 in 10, we can do a lot better than that, right? And so our aim as a company is to put information in as many people's hands as possible to bring that transparency and that empowerment to as many people as we can. And so we do things like reduce the login screen. So there's no complicated logins, passwords, et cetera. You just get in and you see your information and it's clear. And so we end up seeing utilization rates of greater than 60%, 70% in a lot of cases. And that translates directly to all of the other patient experience metrics that health systems care about. Reduction in LWOBs, reduction in length of stay, HCAHPS scores, Press-Ganey scores, all of those things that matter so much have a much greater impact when you're reaching more patients.
Absolutely. And patients, they really want care that feels personal. It's like, and being able to access this is like, oh, you know me, right? Oh, you have all my information. You know me. I can trust you. And they also really want this information in a way that they can access it. As we often think of patients as, oh, they're a patient, they are sick, but they are in fact healthcare consumers, and they have preferences as any consumer would in any industry trying to purchase something or consume something, right? And so I'm wondering, how are data, analytics, AI reshaping the way providers are tailoring those experiences, knowing that? What's the right balance between personalization, privacy, and automation?
Yeah, you bet. I think this is a little counterintuitive. I think it's easy to think more machines, less people, right? More information in your hands, less face-to-face conversation. I actually think that this bridges the gap, that the idea of using AI, LLMs in patient-facing communication gives us a more humanized experience. Let me tell you what I mean by that. If you see your information in your patient portal, it's your labs are the following milligrams and, right, all of the detail and ranges, and it's normal, it's abnormal. You've got to wait for your provider to come in to not only talk to you about what they're seeing, but also explain what all of that means. What if instead you have all of that information in addition to an LLM summarized communication about what all of those lab results meant? Maybe even some video education around what to do if they're high or low. Maybe even some questions that would be good to ask your provider. Then when your provider walks in the room, you're well equipped with the questions and the information that you need to have really meaningful conversations with them. And that way you end up actually bolstering and fostering more trust and loyalty with your provider, because within the short amount of time that they had with you, you're able to get the most amount of meaningful information because you were pre-informed.
Absolutely. And healthcare really is under pressure right now to feel more like retail and hospitality and like all these other, industries that do this very well, this communication thing really well. So, with digital front doors, updates, seamless scheduling, things like that, it's kind of expected. Where do you see health systems are making the first and like the biggest leaps in, terms of what they're prioritizing here and where they're kind of starting to really understand the value, and where are they getting it wrong? Like, are there areas where they're just like, oh, that's not it. That isn't it.
Yeah, it's tough. Healthcare systems have it tough. This is a hard decision to make, to be able to figure out how do we communicate well with our patients in a way that they're accustomed to, but within the tech setting that we have today, right? And I think in that sense, it's really important that whatever solutions they implement integrate really seamlessly with their other systems, their EHR, any sort of clinician-facing communication or information. And so that seamless integration, I think, is just paramount. And a lot of systems are doing that fairly well when they implement the right technologies. But that's the key, I think, is picking what will work best for your patients and the individuals who are in your health system to be able to see their information in a way that feels like the same thing as their providers are seeing, I think.
Absolutely. And it seems too like the large EHRs, they're kind of making announcements that they do lots of different things. And the salespeople of these large EHRs love to say, oh, we do that, right? And so, when we're thinking about that too, like, do they really do that? Like, and what is tricky about that? Why are their current offerings just not quite enough? It will take time to get established, and there's so many pieces that they want to own. Why are they not enough? Why is it important to work with somebody who really gets it?
Yeah, you're exactly right. I mean, these EHR systems, they're really important. They've changed the landscape of healthcare, and they've been able to provide a level of information and transparency to both patients and clinicians that was not nearly as available prior to having them. However, you're exactly right. Just because it'd be great to have all of these wonderful innovations out of the EHR does not mean that they're available now. And patients need them now, right? You're used to walking into an airport with every idea of where your gate is, how long you're going to wait until you board, what different food options are available. And you have it all in the palm of your hand in a single app, not multiple apps, no crazy logins, just it's right there. that's true of hospitality, of getting an Uber, of even looking something up on your phone, right? We're used to having this constant transparency.
Why are EHR tools not enough?
So you ask why EHR tools aren't enough. And I think in a lot of ways, they're really helpful tools, but often patients need a little bit more than they're able to get just with the EHR. And I mentioned earlier the login, right? It's great to have the EHR system that's able to help with your information through your whole longevity of care, from the point of first entering an EHR or an ER all the way to scheduling follow-up appointments 20 years from now. However, in the point of care, you need more information. It's scary. You maybe don't know what's going on. Maybe you need to communicate with your partner or a loved one about what's going on in a way that isn't burdensome to you. EHRs don't really have any of those capabilities right now. They have the information. They should be there. You should log into them long term and maintain your care through an EHR. In a point of care, especially somewhere like an EHR or an ER where, things are scary, or maybe you're taking care of a kid and your partner's at work and you want to share that information with them. I think it's important to have tools in our hands that ease that burden for us, that help us have more information, and that help us have all of that without needing to think too much about it.
Absolutely. Makes so much sense. And, when I think of an empowered patient or an empowered healthcare consumer versus a disempowered one, the difference is data. It's that patient experience. It's that understanding your whole picture as a patient and being able to easily and quickly communicate with your healthcare provider in a way that's seamless. Now, my listeners love to learn about trends in this space. So thank you so much for sharing your wisdom with us. But they also love to learn about women in healthcare leadership like yourself. So tell me, what are some tips and tricks, or what are some things that you do in your personal life to help work your best and make a difference?
Yeah, you bet. Well, one of the things that I do is I take care of myself. And I think it's really easy as women, especially, we've got all of these different responsibilities. I'd say men often do too, but it's very easy to get pulled in a bunch of different directions. And so I read the book lately, Atomic Habits by James Clear. Fantastic book if you haven't read it. He talks a lot about habit stacking, which is basically, if there's one thing that you do every day, throw something else that you know you want to do right on top of it, and you'll always kind of get it done. And I think that's such a fun way to think about going through the sort of steps of life, right? So I know that I wake up and have a cup of coffee every morning, but I also want to start working out every morning. By the way, huge morning workout person. It's such a non-negotiable for me. But if you're not and you want to get to it, maybe it's, okay, I have my cup of coffee and that triggers me to go work out right after that. It becomes sort of a habit trigger. And I love that idea kind of throughout the workday or throughout the evening to create some stability and routine in life that otherwise can be very hectic.
That advice is terrific. And I'm also going to check out that book. I love books like that. They give you amazing practical advice for being able to improve as a human in society, right? Like no brainer.
Yes. Oh my
fantastic. Gosh. And I'm going to try that as well. Because I'm also a morning workout person. And so it's like maybe putting the thing I don't want to do next, right next to it. So I enjoy it. And exactly. I'm doing that thing. That's fantastic. So I'm wondering, if looking back on your career and how you've built it through the years, if you could talk to your younger self, like what advice would you give her?
Oh my goodness. What a good question. I think as I look back and think about where I've come from and where I'm going, I would say to continue leaning on your mentors. It's really invaluable, the impact that people who put time and trust and care into you and your career can have on both your life and career, right? I have a lovely mentor now, Dr. Bridget Duffy, who was first chief experience officer in the country, actually. And so getting to lean on her experience in healthcare IT, but also just as a woman in work and who has had such a successful career, really gives me, I think, the confidence and perspective to be successful in my day-to-day life. So I tell my younger self, find people who are doing things that you would be proud of yourself doing if you were in their shoes, and listen to them.
Love it. Now, to finish this conversation off right, where can our listeners find you online?
Well, of course, you can find me on LinkedIn, or you can find any information on our company, vital.io, also on LinkedIn or on our website. It's got lots of information there about what we're doing to change patient experience in healthcare.
Terrific. Now, before I forget, did you happen to bring tea with you today?
I do.
All right. Tell me about your mug and or tea.
Yes. This mug, it's little hydrangeas, which you also can see in my background, in a canvas tote, which you'll find me running around the city in all the time. But I was in Nantucket with my mom last summer, just a little girls' trip, and we were walking around this little store and both sort of stopped clear right in front of this mug and said, "You have to have that." She said, "You have to have that." And so I think every time I pick up this mug, I think about my mom. And I think that's kind of special, talking about women who we look up to, right?
Absolutely. And a little piece of the coast in the big city, New York City. I love it.
That's right. All in one.
Well, thank you so much for joining us today. It was so nice to have you here.
Well, thank you so much, Grace. It was a joy. I appreciate your time.
And thanks to you folks for joining us too. Check out the High Tea with Grace podcast for more great interviews with awesome people like Kelsey today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.